I've always been interested in medicine as far back as I can remember. My father's a pediatrician, so I grew up making rounds with my dad at hospitals and visiting him at his practice, so it seemed natural to go into medicine. My mom had a love for animals, and it was that love for animals and the marriage between the world I grew up in with my father that brought me into veterinary medicine. Certainly the history of human medicine is quite rich and goes back thousands of years, as does the history of veterinary medicine. But rarely are there opportunities for both worlds to work together solving similar problems.
The New York Veterinary Foundation is an organization that's dedicated to helping veterinary patients, specifically those that may have diseases that are shared between animals and people. There are a number of projects that we've already finished that have published between Cornell and Dr. Marino, and there are, I would say, at least a dozen that we have planned.
We've been able to bring together pioneers in virtually every area of veterinary specialty medicine. We brought together the most cutting-edge technology we could find, and most importantly, we assembled a staff of professionals that care about the patients. By collaborating with researchers on the human side of things, we've been able to foster a relationship with companies like Philips that have made available technology that typically isn't available in veterinary medicine. The 3 Tesla MRI imaging is a type of MRI that gives us distinct advantages, specifically at looking at cerebral spinal fluid flow and the other abnormalities that are specific to Chiari malformation and syringomyelia.
Chiari-like malformation is actually, as of right now, a small dog disease. So Igor is a Cavalier King Charles Spaniel, and he's still doing pretty well. He's starting to walk again, he's getting his strength back, but he's probably the most severe case of Chiari-like malformation that we've seen, and unfortunately, because he's so young, it's so aggressive. But he's a really sweet dog, and he does very, very well with his therapy. He really is trying very hard. So when I first saw the video of a child with the same disease, you just see what the parents go through with the child and all the doctors that they see. It really does hit home. This is a very significant disease, it's a very painful disease, and that there needs to be a lot more research to not only help children, but also help the dogs as well.
Working with Chiari malformation has been a tremendously rewarding experience. Having lectured at human conferences where they invite their patients to attend, and then personally thank us for the work that we're doing that helps their doctors learn more about the disease has been incredibly fulfilling.
The Foundation's goal is to help animals and people, and that is by identifying disorders, some of which I like to call underdog diseases because they are hard to treat. I think that people on the Foundation have the same outlook, is that when we see something challenging like that, we want to fix it.
The New York Veterinary Foundation is also working with service dogs, so police dogs, people with special needs, and helping with the care of the dogs, not just active dogs, but also especially with retired police dogs. And there's definitely a special bond between a service dog and either the officer or the person with the special needs. I mean, they really depend on those dogs, and in some of their cases are lifesavers.
The Foundation provides opportunities to the doctors at Long Island Vet Specialists to go beyond the normal parameters of their day-to-day work. It allows us to spread the word of innovative techniques, things we've generated here through research, through clinical studies, and spread the word amongst the veterinary community so people know what their options are. It allows us to pioneer new techniques, novel treatment options for conditions that were once thought not treatable. So the Foundation really is a tool or a vehicle for us to do the best job we can.
Help support the New York Veterinary Foundation and help us to bridge this divide between human and veterinary medicine.
Please visit nyvf.org or call 516-501-0955.